Dave kept his old employer drug plan and skipped Medicare's Part D. A reasonable choice, except his plan wasn't what Medicare calls creditable. By the time anyone told him, he'd triggered a penalty that follows him for the rest of his life, quietly adding up to thousands of dollars over a retirement. And it all turned on one word he'd never heard. So what makes drug coverage creditable? Why does that one word decide whether you owe a lifetime penalty? And how do you keep from making Dave's mistake? Today, in plain English, I'll walk through the decision that trips up people who did everything else right. Here's the setup. When you turn 65, you're expected to enroll in Medicare's Part D drug coverage, unless you already have drug coverage that's at least as good. Medicare calls coverage that's at least as good as Part D creditable. If your other coverage is creditable, you can keep it and delay Part D with no penalty at all. If it's not creditable and you go without Part D, the penalty clock starts ticking. And this is the trap. Plenty of people keep drug coverage from a former employer, a union, or a retiree plan and simply assume it counts. Some of those plans are creditable, but some, especially thinner retiree plans, are not as good as Part D. If yours falls short and you go 63 days or more without creditable coverage, you owe a late enrollment penalty when you finally sign up. Let me show you how the penalty works, because it's built to sting quietly. It's 1% of a national base drug premium for every month you went without creditable coverage. And in 2026, that base figure is about $39. Go without for 2 years, and it's roughly 24% added to your premium. 3 years, 36%. And here's the cruel part. That penalty is permanent. It's added to your Part D premium every month for life. A few dollars a month may sound small, but stretch it across a 20-year retirement, and it quietly totals thousands. So the danger isn't the penalty itself, so much as the assumption that leads to it. Believing a plan is creditable when it isn't, and finding out only after the clock has already run. So how are you supposed to know whether your coverage counts? This is the part that protects you. By law, your drug plan must tell you, in writing, every single year whether your coverage is creditable, usually by mid-September before Medicare's fall enrollment. It's a notice titled Creditable Coverage. Most people toss it with the junk mail. That letter is the single most important piece of paper in this whole decision. It's the difference between keeping your plan safely and walking into a lifetime penalty blind. Why does this stay so confusing? Because the responsibility is split. Your employer knows if the plan is creditable, but isn't going to chase you about Medicare. Medicare knows the penalty rule, but doesn't see your employer's plan. So the one document that connects them, that annual notice, lands in your mailbox and gets ignored. No villain, just a gap that only you can close. Have you ever kept an employer or retiree drug plan past 65 and wondered if it counts? Tell me in the comments, and if you're not sure, that's exactly the point of today. So here's what to do. Find out in writing whether your current drug coverage is creditable. Check that annual notice, or call your plan's benefits office and ask directly, is this coverage creditable for Medicare Part D? Keep that letter every year in a folder, because it's your proof. And if your coverage is not creditable, enroll in Part D during your proper window to stop the penalty clock before it ever starts. For a free, unbiased check of your specific situation, call your state health insurance assistance program, your SHIP counselors, or Medicare at 1-800-MEDICARE. They'll tell you whether you can safely keep your plan with nothing to sell. Because this is one of those Medicare decisions where doing nothing feels safe and can quietly cost you for life. The word creditable is small, but it's the whole game, and now you know to ask for it by name. So tell me below, did you know your drug plan had to prove it was creditable every year? If this helped, subscribe. Next, we look at what actually survived in Medicare telehealth and the deadline hanging over it. This is general information, not financial advice, and we are not affiliated with Medicare. Always check your own situation. I'm glad you're here. I'll see you in the next one.